about, hopefully all of that will dissipate and it'll be all about the products that we've got coming. So thank you all so much. As Susie said, I am a skin specialist. I've got my own clinic and I've been working alongside Nu Skin now for the last 6 to 7 months on a clinical level where I've introduced every product in the regime to or in the protocol, sorry, to my own clients' regimes. And there is a huge excitement in me for the product that we have got coming. And I actually got to have a preview of this last July when I flew to Utah and went and had a amazing life-changing experience. I came away with this product in the preview phase, and I can honestly, hands down, say I have never used a product and seen such an incredible difference from something that is, led from the active family so quickly and also without having any form of adverse effect or reaction, which is quite uncommon when we're talking about things like retinols. So my aim for this evening is to really be able to arm you with some nice consumer friendly information, but also break down a little bit about the science, because I think this is the area where I have just been in my element with Nu Skin. The science, the innovation, the technology, the resources that we have here as a brand is something I've never ever been a part of in the same way in any other distribution company that I've worked for. So, I've had some real kind of like key experience within the cosmeceutical industry for quite a while over my last 12 years. And I am absolutely blown away with the results that I see from this brand, but also the innovation and how the formulas are put together. So I'm going to try and kind of, lay that out in really nice, easy terms so that we can go to our client base, tell them why the difference and where the difference lays, and also arm you all with some good education so that you know how to use this product effectively and properly, because retinol is an active and it's definitely a key ingredient that we want to see within our own regimes as well as everybody else's, regardless of their skin condition. But you do have to use it in the correct way to make sure that you're going to, acclimatize to it. So one of the first things that I think I will just address is like, what is retinol? It's a big buzzword, obviously, and has been for quite some time now. It's a key component. It's a compound molecule that is made up of a number of different things, even to the point where, we can actually gain retinol from our diets. Carrots, for example, is something where we find our retinols. And it has to go through a process to become bioavailable to the skin and to the body. Now, in the cosmetic world, you have got all different forms of retinols. So if I was to give you a visual to imagine, I want you to think about retinol as starting off as a seed and a shoot that just peeks out of the ground, that then grows into some enormous tree. And think of the stages that it's got to go through and the growth that it has to have to become that end humongous tree. What we then need to do is work backwards, because your highest form of retinol starts at the very top, and that sits within the pharmaceutical world, and it's a prescription only ingredient. And then from there, we start to fall into the cosmetic and the cosmeceutical land. Now, retinol comes in various different terms. You can have retinol spelled with an NOL. You can have it with an NAL at the end. You can have retinil, which is spelled with an NYL. And every time you see a different form of retinol or retinil, there is a process that it has to go through to become bioavailable to the skin. And every time it goes through that conversion, there is a depletion in the product and a loss of efficacy, depending on how many conversions it has to make. So if you're using a very low dose retinol or retinil, it's got to grow a very long way to become that real bioavailable form. And actually with that, you're losing roughly around 10% efficacy each time. Now, if you start from the top end and you're using a nice high dose or a nice bioavailable form, which comes in this form that we have got here, where we're using a retinol, you've only got one step for it to convert into the skin and become a bioavailable ingredient. So this is a really key component. Like, we are using the creme de la creme when it comes to the molecular structure of this product. And that's going to create not only amazing results, but it's going to mean that the skin will be very receptive to it, and it will be able to do the job that a retinol does. Now, what a retinol actually has been looked at over the years is a fountain of youth. It has been developed and redeveloped, and actually, it's the most developed and researched ingredient across the entire board of cosmetics. Um, there's so much research that has gone into this ingredient over the years, and I had the pleasure of taking my own training from Helen Naggs actually earlier on, and to appreciate that we have got a scientist that sits on this board, or that's within this company formulating for us, that has actually been looking at retinoids for 40 years. And what she has seen, and the redevelopment and the generations and how it's changed over these years, must be absolutely incredible. So to know that we're working with something and someone that has seen the development of this ingredient, like, really does pack the power behind this product and the science that's behind it as well. But something that retinol was discovered for initially was for acne patients, and it became a normalizer. So it has the ability to normalize cell DNA. And really, that can be as simple as the science has to get. And what you then have to realize is that as we go through the process, whether it be through aging or environmental factors, our skin cells start to become slightly abnormal and dysregulated, and they don't quite hold the same sort of moisture as what they once did, and they start to become a little bit out of shape and hyperpigmented, and that's when we start to see different appearances. So through the research of retinol being predominantly and initially an acne solution, what they then discovered was that actually it had this amazing youthful element to it. And that's why now retinol is deemed as, the fountain of youth, and a very key ingredient when we're looking at cell rejuvenation, skin resurfacing and normalizing, improving skin tone, texture, condition. Overall, it's an absolute hero product. And it can be suitable for everybody in different forms or different ways of working. And although we're all going to get the one same product, we might all use this in very different ways. So, the real pro to the product is that, yes, we can treat all skin conditions, even your most compromised, but only on the basis that you have fixed that sensitivity, or you've dealt with the concern first, and then you're going to use retinol as something to become a normalizer, or something that's going to enhance and encourage cell renewal. On the other hand, you might come in and use this product as an immediate treatment option for somebody that has got pigmentation, for example, because it's going to be a corrective solution for them. So the pros to the brand, or the pros to the ingredient, sorry, is that it can be something very nice and stable for all skin conditions, as long as it's used in a respective way. One of the kind of cons to retinol is that you can use it one day, but the next you might have a bit of sensitivity with it if you've overused it, or if you've used it in a time or an area where perhaps actually your skin's not quite prepped enough to have that real kind of rejuvenating and exfoliating element. So it really is about, using it with care and consideration, acclimatizing your skin, working your way to a place where you can actually build up how often and how frequent you use the product. Don't go all in on it, every night from the day you get hold of it, because that may not be suitable for everybody. Um, I'll just quickly give you a bit of an insight to what an adverse reaction might look like, because there is a difference between having a full-on reaction to something whilst also having an action on the skin. And retinol is an active, so you can expect peeling, redness, sensitization, a bit of dryness, because it is an exfoliant, so it will push cells up from the bottom and let them slough away. And in that process, your skin might go through a bit of a healing crisis. And it doesn't mean that it doesn't like the product, or you're not going to get on with it. It just means that, there's an acclimatization process that you probably should go through, back off of the product until the adverse effect has settled, and then reintroduce it in a really nice, slow way. It's not in this case, something that I have got any concerns about, because when I say to you, I have done anything and everything to try and create a retinoid reaction in my own skin to see if I can get the irritation from this product. I truly do mean it. I've put it all over my eyelids, I've put it over my lips, I've used it twice a day, I've put 2 applications on in an evening. I've used it when we've had snow. Obviously, I picked up the product initially in the summer. So I actually have really stress tested, the elements of where retinol can be too much. And I wouldn't say I have, anything to either extreme. I don't have the most resilient skin, but I don't have the most sensitive skin either. So I sit really in the normal category. So my personal recommendation, given the fact that everybody suffers with a bit of dehydration and maybe a bit of barrier impairment, unless they're on new skin, of course, because we would have dealt with that through our ceramide and postbiotic pump. Um, let's take the general public. I would really say recommend introducing this product at night times only, and perhaps maybe 3 days apart initially. So that isn't a Monday, Wednesday, and a Friday and 3 times a week. It's actually giving your skin time to go through the desquamation process, if there is one to be had, which is basically exfoliation of the upper layers. Go through the process of letting those dead cells slough away before you start reintroducing the product again. I would also say use it on a night when you're not going to use it with your devices. I religiously do my galvanic 3 times a week. And when I first introduced the product, I would do the galvanic and not follow with my retinol, but perhaps the following night I would use my retinol and not my device. So just be really mindful about the activity you're creating within your skin. And obviously when you're recommending to your clients and your customer base, it's about understanding what the purpose of the product is there to do. And retinol is there to normalize cells, give good rejuvenation outcomes, and also start to improve things like texture, tone, pore size. Obviously, lines and wrinkles, the before and afters are just absolutely phenomenal. The deeper complex that I'm going to go through in a second, really helps to help to target things like elastin, collagen production, collagen synthesis. So there's so much that we can do to condition the skin, but just know that a retinol is a dermal exfoliator, and it will, in effect, drop straight down to the bottom layer of your skin, and it will then start to push from there away the sloughed kind of debris, basically. And that will be a variable for everybody. Some people might hold on to their dead cells for 30 days if they're kind of between their 20s and their 30s. And anything kind of like 30 plus, you can actually start to hold on to those cells anything up to 90 days. So the younger the skin, the more potential peeling or potential sensitivity they might feel because of that exfoliation that's going on. Whereas the maturer the skin and perhaps, the more resilient, then you may feel that actually they could pick up the use and their frequency a little bit quicker. So I hope that really kind of outlines some of the, pros and cons, but not in a way where you need to be afraid of it, because I truly know that the complex that comes with this, and I'm going to touch on key ingredients in a second, has actually done wonders for being able to buffer some of those outcomes that potentially don't come with a normal retinol. The next thing that I would really like to draw your attention to is the fact that retinol is a very key ingredient, and it has a powerhouse of benefits, but it really does come down to its partners and who else it's with. And this is something that I think is really paramount to this product in particular. The key ingredient and the technology that we have here within the peptide complex is a whole new generation that has never been discovered before. And I'm absolutely blown away by how the company have even got to this. So they're using a nature identical peptide. So it's actually derived from the green pea. And that's something that they have been able to discover using like a search engine, so to speak. So the AI element is new modern technology. Once upon a time, when they wanted to look for their ingredients, they would be looking at things like through libraries, science, discoveries that have already been done. And often, it would be by chance what the outcome would be. Nowadays, and because of the computing that we have, we can actually remove that by chance element, and we can start to program the computer to tell it what it is that we're looking for exactly. And that's how this peptide has been discovered. It has gone through the process with the AI technology of over 6 years worth of experimental data from labs, libraries, natural peptides, food sources. And we've been able to basically ask it in a really smart way how to identify an ingredient that will give us this result. And what has been pulled out and extracted from that was the common garden pea. What also is packed within this product is something called 4TB. Now, what this actually means is to be protected. So it has a long chemical name, but the retinol that comes in two different forms. We've got two different types of retinol in here. We've also got the peptide complex that comes from the green pea. We've also got this 4TP blend. Now, everything in this kind of extra bag is dealing with the discomfort that you would normally see from a retinol. And it's perfectly normal to see it from a cosmeceutical brand, a medical grade brand. Like, people are expecting to have an element of adverse effect when using a vitamin A product. And the complex that we have here is there ready made to buffer that level of discomfort that you might see and feel. So you've got everything to reduce the inflammation within the skin and the reaction, but it's just about being able to use it in a way where you know that it's really going to enhance that skin condition. So if you were to use it in an acneic skin, you want that cell rejuvenation to come through, you want the normalization, it will help to mop up excess oil, but you don't want to go and exacerbate the exfoliation process. So for an acne skin, I would just recommend that you use it maybe twice a week. For a rosacea skin, I would recommend it's once a week. And then anything else, whether it be aging or pigmentation, that's when I would say start with your 3 nights apart. So I hope that gives you like a really nice, clear view of how to introduce this to a skin condition. Sorry, Susie, would you just go back for me 2 seconds? The other thing that is also in here, and this is why it's just a powerhouse and the science of it as well, is the age-lock proprietary blend. This is science that has been done for years and years and years on the genetic and the youth gene expression and how to get the skin to respond on a DNA level. And the fact that we have got this combined with the peptide that has shown huge increases in collagen synthesis is also absolutely phenomenal. What I would also just like to say before I obviously have to hand myself back over is the way this compares to another product in the market on a price point level is just absolutely phenomenal. So the retail price of the product is £82. For as long as I can remember, probably the last 4 years, I have been recommending and retailing a retinol product that is £125. So we are so lucky to be able to offer the next generation at a much cheaper price with definite better benefit. And knowing that you have got something that is actually not even comparable to what's in the marketplace now, but also can combine with the treatments and the devices and the other products that we've got, is just something that I would always say to everybody, like, hold that with real pride.